Thank you, Hans, for sharing your personal experiences. It's nice to hear individual experiences going through that process. Much like Hans, I created and managed a gain sharing program for about 4 years. Saw the pros and cons, the pitfalls, and also some of the great things that happened because of it. So
All right,
we
just
do,
before you jump in, I think
yeah,
if you could switch to the slideshow view.
yeah, there
Oh,
we go.
perfect. Perfect.
Thank you, Derek. So I wanted to go through just from a high level, some of the mechanics of what a gain sharing program looks like and things to think about when putting it together and how to be successful. Want to go through some of the pros and cons. How does that actually impact the surgical costs of the hospital? And then the need and the importance of using data to drive these improvements and to track everything that's going on. Um, First and foremost, we need to have physician buy-in. And when I think about that, I think of physician autonomy, not only to opt into the program, but to feel like they can continue to operate in a manner that they see best. And then, as Susanna had mentioned, aligning the incentives with the hospitals, the clinical group, everyone that is involved to make sure we're achieving what needs to be achieved. And moving on in regards to just the data, I can't emphasize the importance enough of having ratified, relevant, and transparent data that is available at all times for all parties. Make sure that everyone is on the same page. In regards to that, want to look at something, like clinical performance feedback as you're implementing a gain sharing program, being able to provide individual and unique data. So here's an example of performance feedback, DRG specific for an individual physician within that department, looking at case volume, costs, how they compare to other colleagues within the department. Very important to have that individualized data along with departmental data, and then being able to see how their performance is affecting the department as a whole. So looking at data and looking at what is occurring over time, this is an example of cost over time for a department, and then also seeing national benchmarks and how that's being compared. So very important to have this longitudinal, both departmental and individual data to track performance, especially on the key indicators that have been outlined in the gain sharing program. Some other items in regards to the clinical staff. We want to maintain professional judgment. We don't want any of this to be restrictive on what can be used, specifically if it's an outlier of a case. We want to do risk adjustment. Let's compare apples to apples and not have the issue of my cases are more difficult. I see a different subset of patients. And then obviously, be inclusive of all physicians. It works best if the entire department is on board, working as a team, and then also driving things individually. So in regards to looking at just a broad structure, again, we want to look at departmental implementation rather than looking at specific action items in a black box. But then incorporate both individual performance with the team performance, and the compensation can be based on that as well. One other interesting thing that I think is a bit new that is not always used, and I didn't use this when we implemented a few years back, is this idea of not resetting every single year. It's easy to say we're gonna achieve the financial improvements, we're gonna distribute, and then we reset. But some of these action items have long tails. We can see savings for years and years, and we want to be able to reward the physicians and the individuals involved in that as those savings are achieved for that greater effort that's put into place, maybe upfront in year one. And then looking at what type of target do we want to set? We suggest somewhere around a 15 to 15% target above total compensation. We don't want it to be punitive, but we do want it to be enough to incentivize the physicians to be involved with the program. This is an example of what we had. So we sorry, we got some. We've got something, but anyways, this is okay. Here we go. Apologize. That was our program. It was very involved. We wanted to create, something very visual. We sat down with physicians on a month-to-month basis. We made sure they were answering all the questions regarding the data, what we were measuring, how we were measuring it. We also looked outside of just financial implications. So we were measuring research, we were measuring philanthropic work, and we had that as part of it as well. Now, once it's implemented, I think the question is now what? Now what do we do? So we need to have joint discovery between hospital and the clinical staff, utilizing that data that we're using to track what is going on to also identify the opportunities. So below you see an example of high-level opportunities identified, supply cost, high incision to closure time, different DRGs or procedures being done, and then begin to dig into that and actually identify who can be involved, what are specific action items, and what do we want to actually target. So an example, we can target renegotiation of a particular total knee construct. Another item, do we want to create consensus statements around the use of antibiotic-infused cement? Begin to really detail that out and make sure we have a map of what we're looking at, and also being able to track that. So speaking of tracking, taking that map, who is involved, and then setting the goals. What are the goals and how do they align both with the clinical group and the administration? Putting a number on that goal. What do we project that this could actually achieve in regards to financial benefit, so that we really understand the effort being put in and what does that outcome look like? And then on a month-to-month basis, tracking the progress of that goal towards that financial benefit when looking at the financial improvements. And then taking those goals and actually monitoring the success again on a month-to-month basis. So this particular goal, $1.2 million, looking at supply costs, savings of $255,000 have been achieved year to date. What does that look like if you stretch that out 12 months? And how is everything tracking compared to what was identified by the data, the action items, and then the goal set? So from my experience, just having that transparency, that clear ability to understand who is involved, what resources are needed, and then actually tracking what is going on a month-to-month basis really makes a big difference when aligning the two groups that are involved, which is generally the hospital and the clinical group.